Well, as we mentioned in our earlier half hour, country singer Toby Keith died today after a battle with stomach cancer. And just yesterday, Buckingham Palace announced that King Charles has been diagnosed with cancer. We do not know what type of cancer the king is battling, other than it is not prostate cancer. But Britain's Prime Minister said today that the cancer was caught early. Joining us now to talk more about the importance of cancer screening, ABC News chief medical correspondent Dr. Jen Ashton. And Jen, since we don't know what's going on with the king, let's talk a little bit about Toby Keith and with stomach cancer. Can you screen for stomach cancer?
You can't, and that's the unfortunate thing. This is one of the less common gastrointestinal tract cancers, more common in men than women, more common as people get older, 60s, 70s, and 80s. And there are some risk factors like heavy smoking, heavy drinking, some ethnic groups, certain H. pylori bacterial infection. But there's no screening test because it's not that common. And so you have to really know your body, know your signs and symptoms. If anything doesn't feel right to you, unintentional weight loss, abdominal pain, generally worse after eating, anemia or blood in the stool, obviously you want to get those things checked out.
And you really need to pay attention to your body because that's the first telltale sign that something's not going right.
Correct, absolutely. And so when we hear a story like this, you know, the bad news is that it's a relatively less common cancer, but we don't have a screening test for it. So awareness is important and knowing your body is important.
But now there are some benefits to screenings, especially in blood tests. I know that there's a couple probably that are markers. I don't know if it's going to tell you right off the bat, right? But like cervical cancer, you see things in the blood test?
So
let's look into this more?
Not necessarily with cervical cancer and blood tests, but there's really exciting research in what's called liquid biopsies, which is, I think, what you're talking about, testing blood cells for microscopic subclinical evidence of cancers, a variety places in the body. We have to remember also, and this really pertains to the news out of Buckingham Palace, when you hear the word cancer, that's like saying we're going to talk about the weather. Are we talking about a sunny day or a hurricane?
It is a huge umbrella of stuff.
Every type of cancer has its own kind of domain and screening tests and advances and research.
You got to ask for something specifically, don't you? And say, well, check for this type of cancer?
Well, your healthcare provider should know what are the recommended screening tests. And again, just because we can look head to toe in some ways doesn't mean we should, because there are risks and benefits to that. And so you can't just scan the whole body, per se.
How common is it for someone to go in for a very simple, common procedure like prostate enlargement and then come out with a cancer diagnosis that is not prostate cancer?
Right. I mean, from what we know, the limited information we know. It happens. It's not that common. It's called an incidental finding. We don't have official statistics on it, but I think it's important. Anyone who's had any elective procedure knows when you go into the hospital or the ambulatory center, you typically will get some blood tests, maybe a chest x-ray, an EKG, as part of the pre-procedure testing. And in some cases, that can pick up something completely unexpected.
Yeah, really, the symptoms are also very important.
Knowing your body and having a good communication with a healthcare provider.
Get a mammogram, get your colonoscopy, get the screenings that are out there that we know about.
That's right. That's all we can do.
Thank you, Jen.
You bet.
It's great to have you on the newscast.